Dr. Tural, can you help us a little bit in guiding of what type of foods a baby and maybe even all the way up to a childhood are good? Because, good foods and nutritional foods, I know I have friends who strongly believe that a pizza and a salami is very nutritional. Now, I personally love pizza and salami. Don't get me wrong, I love it. My wife keeps telling me I would lose 15 pounds if I wouldn't eat that stuff, and it would be much better for me, she says, and she's probably right. But the point is, I do know it's not nutritional, but my friends sometimes don't know that. So, tell us a little bit, not saying what's good food, but tell us a little bit, how to choose the right diet for your baby, if there is such a thing. I don't know.
Well, the early part of the infancy, like the first 4 months or so, a baby would only need their formula. They would not need any other nutrition. Formula is a wholesome diet for a newborn baby up until they are 4 months old or so. Around the time that they turn 4 months or older, they need to learn how to process the solids in their mouth. That comes with first stage food, sort of refined solid food that doesn't require chewing. Just they would have to roll their tongue up and then send the food down their throat. That needs to be sort of mastered. That a young baby at 4 months of age would need to be exposed to that for them to learn how to swallow solid food. And the newborn is a suck and swallow. Like they suck their bottle and then they swallow the content. But this rolling their tongue up and swallowing is solid swallowing that needs to be learned. There's in excess of 20-30 muscles involved in swallowing solid food. So that is a lot of coordination of all those muscles, and then an infant needs to be exposed to that challenge to learn it. So with that around, by giving them a little bit of solid food in their mouth, and then by the time they are 4 months old, they are ready for it. All you have to do is give them the opportunity, and they try to swallow it the way they swallow the liquid. And it doesn't work. They move it around in their mouth around, and then they one way it goes down, and then from then on that registers in their brain, and the next time they try it that way, and then that way they start mastering it. So it's just pretty much like walking. Yeah.
Gradient. It's a gradient.
Yes.
So don't give him a raw T-bone steak as the first bite, right?
Yeah. The first one they need to have. They can't have steak, but they can have the smell of it. But that is not a good idea, because they need to learn the sort of bland tastes they have to be exposed to. If you expose an infant, a 4-month-old, to a distinct taste, that somehow doesn't sit well with the baby. So there has to be a bland taste, like you would have carrots, but it is a bland carrot taste. You wouldn't enhance it with anything, cinnamon or anything of that sort. So, yeah.
In fact, most of us probably can remember that when we were children, strong tasting things we stood away from, be that a sardine or whatever it might be. And it's only as we grow up we were willing to accept that and say, that's good. Now, tell me, I'm sure there are many brands of foods out there. Is there anything parents should know about them? Should they just try? Which one? Are they all pretty good? Is there something I should be careful of? What's the deal there?
Well, we all know that in the U.S. market, all the infant solid food makers are very careful at the sources of food ingredients that they purchase. They go out to check the farms and the quality, and then they check the fact that the producers don't use pesticides and what have you, and then they are pretty reliable. But beyond that, some manufacturers go to the next level, and then they use only organic ingredients. And then they label their products as being totally organic and then totally contaminant free. So
would you think that organic food, be it for a child for that much, or for instance an adult like us, would you see that do you think there is a difference, or do you think it really doesn't matter? Give us your professional viewpoint on this thing.
The trace levels of contaminant probably are acceptable, and of course, at today's economy, you have to be mindful of what you're spending on organic food. For a newborn, for a baby, it could be like it would be advisable to go organic, but if it is assuming consuming 25% of your budget on organic food, then it is probably not advisable. But as I said, all the manufacturers in the U.S. are pretty diligent to choose the food sources that they prepare their solid food from. So all the products are reliable. These are not the differences are not probably significant between organic labels, organic versus non-organic solid food. So my advice would be, it depends on their parents' comfort level. If they're very, very particular about organic being the only form, then they can go ahead and buy that. But otherwise, they can buy any one of the ones that are out there.
So basically, baby foods are out there. It is a matter almost of liking, whether you buy a Toyota or a Nissan or an Audi. It isn't really that big of a difference. It's more like a liking, and that's all there is to it. You'll be fine. You're not going to kill your baby with either one of them. Is that what you say?
Right. Exactly. They are equally nutritious and then safe.
Yeah. However, could it be that a baby for some reason doesn't like, or for some reason there's something in there which makes the baby vomiting and stuff, so just go away from it and buy a different brand or a different particular, which doesn't even have, let's just say, peaches in it instead of carrots or whatever it may be. Just change,
right.
and you usually will be fine if the baby reacts negatively to a particular food.
Right, yeah. That would be mostly for the type of food a baby reacts to. My recommendation would be that parents should stay away from that particular type of food, say it's carrots. I wouldn't advise them to go and then buy a different brand of carrot baby jar, but stay away from carrots.
Yeah. So basically, don't force feed the baby a particular thing, whether it's carrot or beans, because you think it's healthy. All the baby foods have the basic nutrition in it. Just keep getting something the baby eats.
Right, exactly.
Thank you very much. Appreciate it very much, Dr. Tural.